Pulse oximetry. Oxygen saturation, sometimes referred to as the fifth vital sign, should be checked by pulse oximetry in all breathless and acutely ill patients. SPO2 and the inspired oxygen concentration should be recorded on the observation chart, together with the oximetry result. The other vital signs of pulse, blood pressure, temperature, and respiratory rate should also be recorded in situations where supplemental oxygen is required. Pulse oximetry is a painless, non-invasive method to monitor SPO2 intermittently and continuously. The use of a pulse oximeter is indicated in patients who have or are at risk for impaired gaseous exchange or an unstable oxygen status. The pulse oximeter is a probe with a light-emitting diode that is attached to the patient's finger, forehead, or ear. Beams of red and infrared light are emitted from the LED, and the light wavelengths are absorbed differently by the oxygenated and the deoxygenated hemoglobin molecules. The receiving sensor measures the amount of light absorbed by the oxygenated and deoxygenated hemoglobin in the arterial pulsatile blood. The more hemoglobin that is saturated with oxygen, the higher the SPO2, which should normally measure above 95%. Pulse oximeters have an indicator of signal strength, such as a bar graph, audible tone, waveform, or flashing light, to show how strong the receiving signal is. Measurements should be considered inaccurate if the signal strength is poor. Pulse oximeters will also indicate heart rate by counting the number of pulsatile signals. To ensure accuracy, count the patient's pulse rate by taking the pulse and comparing it to the pulse rate shown on the pulse oximeter. The most common cause of inaccuracy with pulse oximeters is motion artifact. Patient movement can cause pulsatile venous flow to be incorrectly measured as arterial pulsations, thus producing an inaccurate oximetry and pulse rate reading. Another common cause of inaccuracy is poor peripheral perfusion. Poor peripheral perfusion can be caused by conditions such as hypothermia, peripheral vascular disease, vasoconstriction, hypotension, or peripheral edema. A forehead probe can be used for patients with decreased peripheral perfusion. Conditions such as jaundice, as well as intravascular dyes and carbon monoxide in the blood, can also influence oximetry readings. Anemic patients with low hemoglobin may have a normal SPO2 reading, even though the available oxygen is not enough to meet the metabolic demands of the body. Patients with elevated bilirubin concentrations may also have falsely low SPO2 readings. If measuring SPO2 by attaching the probe to a finger or toe, check the radial or pedal pulse and capillary refill of the finger or toe you plan to use. If the patient's extremities are cold, you could try to warm his or her hands in yours, or apply warm towels to improve perfusion. The patient's finger or toe should be clean and dry. Check that the patient does not have artificial nails or nail polish, as both will influence the light transmission and should therefore be removed before applying pulse oximetry. Check that the probe is positioned properly so that optical shunting, when light from the transmitter passes directly into the receiver without going through the finger, does not occur. Bright ambient light may also affect the accuracy of pulse oximetry readings. Pulse oximetry is generally considered to be a safe procedure. However, tissue injury may occur at the measuring site as a result of probe misuse. Pressure sores or burns are possible effects of prolonged application. Pulse oximeters are an unlikely home health essential. A pulse oximeter works by transmitting a wavelength of light through your finger or earlobe. This light finds hemoglobin, the protein in your blood that carries oxygen, and the amount absorbed by the protein varies based on how much oxygen is already saturating it. A sensor on the other side of your extremity then calculates your blood oxygen levels based on the light wavelengths received, along with your blood pressure and pulse rate. Already an essential for those with asthma or other lung diseases, a pulse oximeter is an affordable investment that could give peace of mind during respiratory illness. It's not only easy to use, but it gives valuable insight into health that could be helpful to healthcare professionals. Blood oxygen levels matter. When you breathe in air, tiny capillaries in your lungs absorb the oxygen, allowing it to enter into your bloodstream. Red blood cells then carry that oxygen to tissues throughout the body, including the brain and other vital organs. A low oxygen level in your blood could lead to low oxygen in your tissues and, ultimately, organ failure. Pulse oximeters may be useful because blood oxygen saturation levels that start trending downward could be a sign that your lungs are faltering and that you need to call your doctor. Oxygen saturation can be measured using a pulse oximetry device, which is a non-invasive method to measure arterial oxygen saturation levels. In critically ill clients, a more invasive and continuous monitoring system is used to measure arterial blood gases through an arterial line. An arterial line is a catheter that is inserted into an artery, usually the radial artery. It provides a way to access blood gases, including arterial oxygen saturation. Here we focus on pulse oximetry because it is identified as a vital sign. A pulse oximetry device includes a sensor that measures light absorption of hemoglobin and represents arterial SPO2. Oxyhemoglobin and unoxygenated hemoglobin absorb light differently. The sensor measures the relative amount of light absorbed by oxyhemoglobin and unoxygenated reduced hemoglobin, and compares the amount of light emitted to light absorbed. This comparison is then converted to a ratio and is expressed as a percentage of SPO2. A pulse oximeter reading reflects arterial oxygen saturation levels as opposed to venous oxygen saturation levels because the device only measures light absorption of pulsatile flow. The P in SPO2 refers to pulse or pulsatile flow. If pulsatile flow is limited or obstructed, an oxygen saturation level will not be accurate. For example, the compression of a blood pressure cuff will obliterate the pulsatile flow, so blood pressure and pulse oximetry should not be taken simultaneously on the same limb. The sensor is attached using various devices. One is a spring-loaded clip attached to a finger or a toe as shown. It is used when an intermittent measurement is required. However, this clip is too large for newborns and young children, so for this population, the sensor is taped to a finger or toe. This technique is also used for clients who require continuous monitoring.